Welcome to your Future Therapist podcast. I'm your co-host, Kelly Newsome. Today, I'm talking with Maria Thomas about elderly care. So good to see you. Thank you again,
You,
Maria.
it's good to see you too.
Thank you. So the subject came up via a text convo, and you had mentioned just how hard kind of the last few months had been. And I asked why, and you said, well, taking care of the old folks, right? And how much time you spend and how stressful it is, and that you and Sean are like the single child, right? The only
Yes.
children, and the pressures that come from that. But before we start, I just wanted to share some statistics from the Bureau of Labor Statistics, and this comes from the U.S. Department of Labor. It was released September 21st of this year, and I'll put the link in the show notes so anybody can take a look at this. So I have three statistics. So of the 37.1 million elder care providers in the civilian non-institutional population, so that's you, Maria,
Yep.
age 15 and over, the majority, 59%, are women. I thought that was very interesting. So individuals age 45 to 54 and 55 to 64 were the most likely to provide elder care, following by those ages 65 and older. Over half of elder care providers ages 25 to 34 cared for a grandparent, while the majority of providers aged 35 to 64 cared for a parent. Providers ages 65 and over were more likely than those in other age groups to care for a friend or a neighbor, which I thought was really interesting.
Very
So,
interesting.
yeah, so there's, so many more statistics. Those are just the first three that kind of popped out at me, but I was wondering if you wouldn't mind just summarizing kind of what you and your husband are experiencing.
Yeah. So 4 years ago, my mother-in-law was diagnosed with early onset of Alzheimer's. And, which is shocking to get that. And then you have to ask yourself, okay, now what? And so that really sent us down a path of, discussing with her what her expectations are. And we didn't know anything. I didn't know anything. So we've always taken care of our people, and there's always been somebody there to do it. The older generation, so to speak, would take care of the very old, but I heard a very interesting term, which is called the sandwich generation. My therapist was saying that, so then you have, people are living longer and we're having kids later. So now we're sandwiched between taking care of an old person or old people and still having kids in high school.
Mm.
And it is really, really hard. And that is not something I ever thought of, understood, but I'm seeing it more and more. And it's really, really hard.
And so you had mentioned that you had made a comment like you didn't know anything. Can you kind of expand on that? What does that mean, like in the world of dementia or just in healthcare? Kind of lay
All
out
of
the
it.
picture for us. Okay.
Yeah, sure. So I did not have very much or any experience with someone that I knew directly that had Alzheimer's. And my mother-in-law was 67 when she was diagnosed. So that's very early. And so we just started going down the path of educating ourselves. We went to the alzheimer.org website, and it talks about the different stages. And because Alzheimer's is so crazy, there's no rhyme or reason for a lot of things, that you can go in and out of stages, you can stay there for a while, you can go way down, skip them. It's all out there. And so that alone scared me because you don't know how to prepare.
Mm-hmm.
And so then the question came up about finances. And in our case, my mother-in-law, being young, didn't prepare correctly. So in having conversations with her about what we were going to do and how we were going to kind of, first of all, those are very hard conversations because someone has just gotten a diagnosis that is horrific. And but going down that path, I started, well, let's look into this, figure out what is there for people who don't have, huge retirement, money sitting there. And so All the places, the very nice ones, are between $7,000 and $10,000 a month. Private pay, period, dot, done. Shocking to me, didn't know. And so because my mother-in-law is so young, she could be here for 20 years. So
Mhm.
that's not really an option for us. So I just went down the Medi-Cal, the Medicare, and just calling anybody and everybody in the senior realm. And eventually I got to a great person who was very, very helpful.
Okay. And is that a resource that we could share in the show notes, do you feel, or?
I feel, I don't, I think what, if people are trying to find a senior advocate, they just start calling the county, their county that they're in. And the honest truth is we had to call Vacaville for some of these because Yolo County doesn't necessarily have some of the options that maybe a bigger community has, bigger county like Sacramento. So,
Okay.
I think the most important part would be to just look at all the resources that are out there for you and go all the way to the end,
Mhm.
because you don't know when the end will be there. I mean, these things so if we educated ourselves enough so that we are prepared for step 2, 3, 4, 5, and whatever.
Right. So tell me what kind of care are you and your husband providing for your mother-in-law? What does that look like?
Well, one of the things that would surprise people is when you have kids at home and a business and busy lives and things, the amount of time that our senior family members need, it's a lot. And you feel a little bit like you're invading their privacy because you're so involved in all the medications. Are
Mhm.
you using the bathroom right? Are you eating right? I mean, it's a lot. And so we for her, we kept her in her place as long as we could. Then we moved her to a senior apartment. And then we got her a caregiver that would come over a couple days a week. And caregiving is tremendously expensive. So, you have to go and try to we had a local company that's a bigger company come and take care. And it was $3,000 for part-time for 1 month.
And how often are they coming in that scenario?
Well, in this particular company, it was at least 12 hours a week.
Okay.
So you had to do like 24 hours as the 2 weeks minimum, something like that. And so, yeah, I mean, it was 2 weeks and it was $3,000.
Oh.
And so, the money goes fast. And
Mhm.
if you could be here 10 or 15 years, that's the overwhelming part. And so, and finding the right caregiver, for, my mother-in-law, she's super easy. That was easy. But,
Mhm.
some Alzheimer's patients aren't easy, so, but yeah, trying to find the best care for her. And what had happened is going there 3 days a week, 4 days a week. And then Sean is going and I'm going in between, making
Mhm.
sure her medication is right. And then it got to the point where she couldn't even take her medication correctly. So we knew that the higher level of care had to happen. But we were prepared because we knew exactly who to call, where, and the thing is, you have to wait for a bed at a convalescent or skilled nursing. So you get your name on that list early is what I've
Mhm.
learned.
Okay.
So then it was an easy transition.
I'm a little like lost for words because I imagine that not only is it just like the physical time, but the mental amount of time that you have to spend planning, thinking about, worrying, and then actually when you're there, just the stress of this, right? Can you talk
Yes.
a
And
little bit about that?
yeah, the other part, in addition to that, is the times that you're not there
You're
and your work, like you were saying, it's on your mind all the time.
Mhm.
And
Even when you're not there.
yes, and the other part, I don't know if I had mentioned that my husband's an only child and I am also an only child.
Mhm.
So there are no siblings to help us. And it weighs on you. And for my husband, taking care of his mom, that's hard.
Mhm.
It's hard for him. He doesn't, that's not a comfortable place to be. So I would say that we think about this, every day for sure, multiple times, just to be, now that she's in a safer place and we know that she's taken care of, we don't have to worry. It's been a huge relief. And it's only been a week now that she's
Oh,
been,
wow.
this
Okay.
is brand new,
Okay.
because her level, all of a sudden
Mhm.
she just could not take care of herself.
Okay. So when we texted, was a lot of that stress kind of that transition also from the care that you were providing her and then her going into a care facility? I mean, I imagine that that alone is a whole process in itself.
It absolutely is. And she was not a willing participant.
Mm,
She didn't know all the behind the scenes stuff. We just, we're trying to tell her at, each time we saw her, eventually this is going to change. And she's like, I don't want to leave my place. And I understand that. But so we just had to tell her that, it's about safety and we want you to be safe. And she was very angry and said a lot of awful things to Sean, which is I completely understandable. And I mean, it hurts his heart, but he knows it's not, his mother saying those things. And he's doing what's best. But I will say you second guess yourself all the time. We
sure.
second guess ourselves. And we've got a really good family that is very helpful and understanding. But even with that, people will second guess us and want to give us advice or ask if we could do something else. And I resent that thoroughly.
Hmm.
Like Brene Brown says, if you're not in the trenches side by side with me, I don't need your opinion and I don't want
Yeah.
it. And I have flat out told people that, because that's what you have to say. Because it's a little bit insulting when they go, why can't she just go to the Californian, or go to the
Right.
cute little place? It's like,
Hmm.
it's not that simple. It's
I mean,
really
that's a
tough.
whole nother side, Maria, that we didn't even kind of talk about at leading into this conversation is I mean, peer or family pressure for the decisions that you are. I mean, you didn't ask for this, right? These things came to you because you were the ones that were available and I guess made the most sense, right? A child for their parent.
That's right.
But one part, I guess it is the pressure that you feel or the opinions or the chatter that other people feel they can just put on you, and have actually expectations that you answer them. That's the crazy part, right? That's pretty, yeah, that would
And
be
I
very
think
frustrating.
it is very frustrating. And I think because we second guess ourselves, we
Hmm.
want to explain, like, no, 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 really, and then of course that makes me angry after, because I'm
Right.
like, how dare you people making me try to explain something that I've been dealing with for 4 years and you've been up
Exactly.
here one time, so
Yeah.
there is resentment there. And Sean feels really bad because he's trying so hard to do everything for his mother, who he loves very much,
Hmm.
and second guessing all himself all the time is really
Sure.
hard, just that alone.
Well, it's an immense responsibility, right? And that you've never had to do to this extent. So it's all such new ground that you're kind of, traveling and is it traversing, trying to figure
Yes.
out like how to get your bearings. But also, this is his mother. And I'm curious if you feel comfortable sharing. I imagine there's a mourning period, right? Where your mom is not your mom that and life is now different with that person. Have you experienced that? And is that a topic of conversation for you too?
Yeah, early on it was kind of out there, oh, someday this is going to happen. And so things were kind of status quo, at first, small changes. But then, I will say the things that I've learned about Alzheimer's, one of the things is that it loves depression, and it actually moves forward, it eating the brain like 3 times faster with unchecked depression. And, and then isolation, all of those things, because people with Alzheimer's need lots of, attention and things. And so I think Sean, for both of us, it was status quo, like I said in the beginning. And then as things does it. But this is also a very emotional thing, watching your mother lose her mind, you know?
Mm-hmm.
So he some days he can see it and some days he doesn't want to see it. It's really hard, you know, it just
Yeah,
breaks your heart,
absolutely.
you know.
Absolutely. And, we don't, I mean, now it's more of a reality. I mean, obviously, with the statistics I shared earlier, that children are now, adult children are now caring for their elderly parents way more than ever, right? And
Right.
so it's such a change in direction of the world that and have known your entire life to then now be the caregiver. So, one of the things that came to mind when we were talking earlier is kind of the effects of your family dynamics. I mean, you had mentioned, the sandwich generation, and you have, two not young, but like young adult child. And then also one, is he a senior?
He's a junior this year.
Junior in high school. I mean, so,
Yeah.
and there's so much that happens with your children when they're in school and especially in high school. And so your time is just being torn apart.
It is a very awful situation when you have to choose between going to your son's basketball game or
Mhm.
sitting with your mother, and it's not a good situation, you know. So the family dynamics, the time is huge. That's a very big thing. So you end up feeling a lot of guilt, you know, because like you're not there. And then if you're not at your kid's game, you feel guilty for not that, you know, and there is some resentment that you have inside that you're like, damn it, why do I have, this is awful. Why? This is so unfair to
Mhm.
us. But, you know, you go through that and you just, you know, you have to get past that, you know. And so we've just done a good job of trying to find right caregivers so that we can still have our family time.
Mhm.
Because that's very important, because our son he gets to have us until he graduates from high school.
Right.
That's just how it's going to be. And so, you know, it's finding the best caregivers that you can in the price that you can find, and all of that. You know, I think one thing I will say that's positive in being an only child is that we don't have anybody to argue with, you know, or if, because
Yes.
I've heard stories where some kids
Oh.
are like, no, I'm not doing that. So then it falls on one person, right?
Mhm.
And maybe the daughter, the brothers are not interested or whatever it is. And that creates a lot of resentment. I would think,
Right.
I know I would be resentful if I'm doing all this work and nobody's helping me. So having, you know, being only children, we kind of just have each other and we commiserate and we kind of,
Mhm.
and, you know, so that helps us a little bit. The other thing that's really important is to know your strengths, because like I'm not, I hate to say this to the world, but nurturing and nursing is not my strong suit. It's just not.
Mhm.
So I'm really good at research and calling people and tracking down and being the advocate, because you
Mhm.
have to have somebody who's advocating for you. So I think early on we decided, like, I take the paperwork side, you take the hands-on side, as far as, you know, and just try to help each other the most you can, because it is really hard.
Thank you for sharing that, because I think that I'm sure you are 100% not alone. But in saying that, I mean, you will make people feel so seen, because I'm sure that they've held that comment to themselves because they think they should be totally nurturing and caring and loving. And in this situation, Maria, and especially that it's your mother-in-law, it's not the blood, relation that
Yes.
it it it's this is the reality. Not
Yep.
everyone is able to be that nurturing and caregiver. And that's totally okay. And I love that you called out how your strengths. I think that that's so important to understand and to be okay with, right?
Yes. And the other thing that has come up in the family dynamics that was not anticipated was the effect that it has on our other older people, my mother,
Mm,
my aunts, the other aunts. And so my mom sees the struggle that we're going through. And she, you know, my mom is going to be 85 next year, and she's healthy and still does all her things, and it's all great. Thank you to the universe, and to
Mhm.
her for taking really good care of herself. But she's also sees how much pressure. So she always says, don't worry, you won't have to do these things, which makes me feel horrible because,
Right.
because if I'm venting of my frustrations, then I can easily see where she would put it on herself. And so I had to have a sit down with her and say, look, I need to vent, but besides all that, I will always take care of you. Your situation is completely different. You are financially set up. We've talked about this before. Um, so, but it does make her feel a certain way too, it's
Yeah.
hard.
And speaking of finances, what would you suggest to people our age, right, who do have elderly parents that this could, or any type of care might be needed? And finances is such like a taboo subject, but it is so required in this particular situation, right? Like you as the child deserve to know and understand what your parents' financial constraints, or what's, what are you allowed to utilize for their care. How would you suggest, if you've never had those conversations, to kind of embark on that?
Well, I mean, they can use this podcast to say,
Mhm.
hey, I heard this, let's talk about it, because, it's a conversation that you have to have early on,
Mhm.
and if you haven't, it's never too late, but have it anyway. But it is an intrusive conversation, it's
Yeah.
like, where's your retirement? How much do you have? Have you taken care of this? But the things that I did is, do you have a will? I mean, I knew some of this with my mom already. Do you have a trust? Those
Mhm.
are super important. Where's your money? Where, how? And the other part is, what is your expectation for your care, but what is your expectation for me in that realm?
Mhm.
Because some people would say, I am all good, I don't need, just come and visit me on Sunday or whatever it is. Some will be like, I don't know, I haven't thought about it yet, because nobody wants to think about all that junk. I
Right.
mean, this has made me think about it. And we've already had a conversation with both our boys to tell them that, don't worry, we have it squared away. And, whatever happens, we are prepared financially, because it catches you off guard. And being younger and having to deal with this, you know, we don't have all the time. We're not retired. So
Mhm.
we're not just
Right.
doing our own thing. Retired people are busy too, but you know what I mean? We're still
Mhm.
trying to make the train go. It's
Yeah,
tough.
you're still building your financial freedom, right? Like you're still
Yes.
creating your financial world. So that makes sense. How did that conversation with your boys go?
I think our older son understood, and he said, Mom, it's okay. I know you guys have taken care of things. It makes me want to cry, really, because
Mhm.
having those conversations, you're talking about your own mortality, and then you're
Mhm.
talking about, dying to your children. I mean,
Mhm.
geez, and our younger son, who's 16, he's like, yeah, whatever, you guys, I
Right.
know you got it. He's not seeing it with the same kind of eyes that the rest of
Sure.
us are. um so it wasn't difficult because we are prepared. It's when you're not prepared, I couldn't imagine how difficult that conversation would be. I mean, with Sean's mom, she was like, well, I guess we'll just figure it out, because there was no turning back at that point. We were already down the road.
Right. Exactly.
There was nothing to
Exactly.
fix or change at that point.
Man, Maria.
There's something else I want to say
Yeah,
too
please.
about, I know, I'm thinking, culturally, there's lots of cultures that do multi, and everyone
Mhm.
stays in their house. And historically in my family, all our people have been at home. Nobody's been in a care facility. So we look at that like, ugh, it would be better to be at home and taking care. Um, but people were prepared to do that. You know what I mean? And
Right.
so it
Mhm.
was,
Well, yes. I mean, children grew up with their parents caring for the grandparents in the home. Like generationally,
exactly.
it just happened over and over. So it was just
Yep.
part of the family culture. But
Yep.
yes, we are very decentralized in that in that way, right?
Well, yeah. And if you don't, I mean, we're not in a situation where we could keep her safe at our home because someone
Mm,
needs to be with her to, because there's many, we have a pool. I mean, I could, go
yeah.
on and on, but so, that was not an option for us right now. Like
Hmm.
maybe in a while down the road, it would have been, we could have handled that, but we can't. So then, of course, we have to go the institutional way, and they're not pretty, which is really heartbreaking.
Yeah. Yeah. Cause that's just another set of worries, right? That
Yes,
putting her, I mean, there's obviously lots of horror stories that we don't have to get into, but you just want to make sure that she's cared for and safe and all those things.
that's right. And
Yeah.
then, one of the things, it's only been not even 2 weeks yet since she's been in there, but one of the big things is that now we can just go visit and just enjoy,
Yes.
as
Hmm.
opposed to hands-on dealing. No, we got to do this, we got to do this. And so in that way, it's a positive
Hmm.
because we can go and watch. She likes to watch the 49er game, and visit with her. And you know it, it's a good thing. And then I think it's going to be even better. And I think she feels more safe, so she can calm down a little, like relax her
Hmm.
system. Because can you imagine waking up and having flashes of moments where you're not in the right
I
situation?
know.
I think that everything I've read, that's the hardest part before it's your mind is completely gone. And
Yeah.
my heart just goes out to everybody dealing with that
Yeah.
horrific disease.
Mm. So, can I ask about what you've been under tremendous stress and I'm sure anxiety and just the pressure that you've been under. How have you been able to self-care?
Well, like I said, I'm not very good at nursing, but I am very good at my own self-care. Because I've learned over the years how important it is.
Mhm.
So when I feel, I book a massage and I just
Mhm.
go. I don't, and Sean and I will go to dinner, and we, will say, let's table that conversation and just dream about fun stuff and talk about other things. So we have to remove ourselves from it a little bit
Mhm.
and like turn it off
Yeah.
because it's always on. So those are things. And I can see when I can feel his energy when it's getting too much. And so, I'm like, hey, can I take some things off your plate? Because I know you have, extra. And just we treat each other with kit gloves a lot more. I mean, we've always been obviously kind to each
Kind.
other,
Yeah.
but
Yeah.
now we hold a very special place for each one of us to have our moments, because
Mhm.
we've had them all along the way where somebody's had enough, can do no more.
Mhm.
And thankfully we haven't been in the same bad place at the same
Right.
time.
Mhm.
So it's just being trying to be kind and loving and gracious with each other. It's
I
hard.
love that. Yeah, I that's special though that you are both able to get to that place where you understand that and make room for, the feelings of overwhelm and all of that. I mean, that's so important just for your relationship too, because that has changed due to, I'm just making some assumptions that, it's probably changed a little bit, but you both being able to find the ways to kind of like connect differently is so important.
For sure. And
Yeah.
I feel, because I could see, like, say, if in a different situation where an older person, the parent has been very selfish, let's say, or whatever, and now you're having to take care. I mean, he and his mom are on great terms, but what if you have
Mhm.
to, I don't know what that would be like to have to take care of someone that didn't take very good care of you, let's say, maybe
Right.
when you were a
Mhm.
child. those are
Mhm.
those are real things,
Right. Yeah.
and so my heart aches that he has to do all this. And he's 47 years old. That's a lot for a man, and
Yeah.
watching his mom like that. I just
Yeah.
try to remember that.
Absolutely. Anything else that you'd like to add as we part or end this conversation?
One of the things is there are a lot of resources out there. Now, maybe they don't all meet, but I mean, from in-home supportive services, they call IHSS, to the care card, to Meals on Wheels. I mean, those things we could put in the show notes. And I mean, people can find those in their own
Mhm.
community. And, if you're, I guess, we're in California, so they're definitely here. And I'm sure, they're in other places. And if you can find yourself a good senior advocate that knows, the paperwork part of it. That's the thing, because there's so much paperwork involved. And I think if the very first thing, if this comes to anybody's way, is to get the doctors all on board and to have a team. And you can ask for that. You can ask for meetings. You have to be your own advocate. I have to stress that, because many times people will say, well, that's what they told me. It's like,
Mhm.
no, that is not good enough. You can't be passive. That's my biggest point, because you're advocating for someone else. And in some of these cases, people maybe are not working at their top, whatever. And they're just
Right.
like, yeah, they're very, some people are lackadaisical. Oh yeah, just send us a form or whatever. But it's really important to stay on top of it and to not take no for an answer. That's what has worked for us.
That is great advice. And I will put all of the resources that you noted in there if I can find like the local or California, but like Maria said, you can Google these items and for your local area. Maria, thank you so much for sharing this part of your life with us. I think that, not just with Alzheimer's, but also just elderly care in general is, a topic that I think especially for our demographic of listeners, it's probably being experienced more than we know by our listeners. So I really thank you for sharing everything and being so open.
Well, thank you. I feel like if anyone has any questions for me, I'm happy to answer them. And, I wish that I would have had a place to go to learn
Hmm.
about all of this. And I'm happy that I know this now. And I certainly am happy to share anything I can with anybody, because it's an emotional thing. Um, it really can knock you off your feet, and being as prepared as you possibly can um, helps. It really
Okay.
does.
So
Yeah.
what we'll do is I can just say now, if you have questions for Maria, send them our way and then we'll forward them
Yeah.
and we'll make sure to share their email with you, Maria. That way you can respond directly if you'd like. And
I'm
you
happy to
can,
do that.
yeah, you can reach us at yourfuturetherapistpodcast@gmail.com.